Jasmine Blanco, and this is my vitamins and minerals project, specifically calcium and vitamin D. First part will be my dish and the minerals and vitamins within it. Today's dish, we're going to be making a smoothie. First, we're going to put some milk, orange milk, some orange juice, a little scoop of yogurt, some ice, spinach, and almonds. Here we're going to blend it. And now we're gonna taste it. Just get this cup. And pour. And now we're gonna try it. And it's full of vitamin A, vitamin D, vitamin C, calcium, iron, and vitamin B6. For part 2 of my project, I'm going to be talking about food sources for calcium and vitamin D, as well as optimal environment for absorption. We're going to be talking about calcium and the foods that it can be found in, such as milk products and some grains, as well as the ideal environment for absorption, which is dependent upon your vitamin D and phosphorus intake, your body's needs, such as pregnant women who need the extra calcium for the baby, your calcium intake, your protein and carb intake, an acidic environment, as well as weight-bearing exercises. The rate of absorption can be limited by 35 grams of fiber intake, as well as oxalic acid in some vegetables. Next, vitamin D and some foods where it can be found in, such as milk, some orange juice, fish liver oils and salmon, butter, egg yolk, yogurt, as well as yeast and fortified margarine. As for the environment, it's dependent upon your vitamin D intake, as well as your sun exposure, and as well as your age, because when you become elderly, your skin starts to change and it can't absorb the sun as well as it used to. Okay. For the third part of my project, I'll be talking about the function, deficit, and excess of calcium and vitamin D. Regarding calcium, its functions include to strengthen and harden your bones and teeth, as well as dealing with heart function, cell metabolism, blood clotting, and normal nerve and muscle functions. A deficit results in bowed legs, rickets, pigeon breasts, enlarged wrists or ankles, stunted growth, osteomalacia, involuntary muscle movements, and osteoporosis, which is typical in females due to childbearing. An excess of calcium results in constipation, kidney stones, and limits the absorption of zinc and iron. For vitamin D, its functions include being fat-soluble, promoting the absorption of calcium and phosphorus, promoting growth through bone mineralization, maintaining the blood calcium levels normal, regulating neurotransmitters, and having a nerve growth factor, as well as producing endorphins so we can feel good. A deficit includes rickets, Crohn's disease, cystic fibrosis, celiac disease, and pancreatic insufficiency. An excess of vitamin D results in hypercalcemia, muscle weakness, falls, bone pain, and bone fractures. For my third part, it'll be lab values expected for calcium and vitamin D. Lab values for calcium is 10 milligrams per deciliter, and for vitamin D, if you're under the age of 70, it's 15 micrograms, If you're over the age of 70, it's 20 micrograms due to their skin not being able to absorb the sun as well. The end.